We are the members of the Bloom Cardiovascular Institute's transcatheter heart valve team at Northwestern Medicine. We are cardiac surgeons.
Cardiologists,
nurses,
radiologists, echocardiographer,
physician assistants,
nurse practitioners,
anesthesiologists,
and social workers. And for all of us, as always, it's what we do for our patients every day that matters.
The Bloom Cardiovascular Institute has a long-standing history of treating patients with transcatheter heart valve therapies. In fact, in 2008, we performed our first transcatheter aortic valve replacement in the PARTNER 1 trial.
TAVR stands for transcatheter aortic valve replacement and is just one of the many procedures that we offer. We also offer transcatheter procedures for the mitral and tricuspid valve.
We are honored to have performed more than 500 TAVR procedures and counting at the Bloom Cardiovascular Institute. We are proud to be the highest volume and most experienced TAVR program in Illinois.
Transcatheter heart valve therapies are minimally invasive, helping patients feel better faster, and can improve survivability by up to 50%.
These therapies are life-saving procedures, originally designed for patients not healthy enough to undergo traditional open heart surgeries.
But now, transcatheter valve therapies are available to an even larger group of people. High risk, intermediate risk, and now low-risk patients.
So how does it work? We use a small tube or catheter that goes into an artery and then into the heart. At the end of this tube is a balloon that expands the new heart valve over the diseased valve. The new heart valve now takes the job of regulating blood flow.
Because this is what healthy heart valves do best, regulate blood flow.
We are amazed by the dramatic improvement in health and quality of life that these patients experience after having had this minimally invasive heart valve procedure.
Patients are now experiencing shorter and shorter hospital stays after transcatheter heart valve procedures.
Healing from minimally invasive procedures is faster than open chest surgery.
Transcatheter heart valve therapies are one of the most significant advancements in medicine in the past 20 years.
We've been expanding the number and type of patients we can help with these therapies by participating in clinical trials that help advance future technologies.
Since my procedure, my heart is working much better, and I feel great.
Without a doubt, Bloom Cardiovascular Institute is a national leader in transcatheter heart valve therapies.
Patients come to the Bloom Cardiovascular Institute because of the expertise of our physicians and the entire team.
For our patients, transcatheter therapies are
revolutionary,
a game changer,
inspiring,
innovative,
life-changing,
helping me breathe easier again,
helps me walk more easily again.
If you've been told there's nothing to be done for your heart valve disease,
chances are our team at the Bloom Cardiovascular Institute can help.